Hi, this is Sydney, and this is my heart, lungs, peripheral, and extremities videos. We're first going to just pan the room to make sure there's no cheating, no notes. Behind me is Erica. No notes, panning up, ceiling tiles, floor, the good stuff. Cheating. Erica again. Alright, so first I'm going to come into the room. I'm going to check the chart to see if there is any past heart or lung issues that I need to be aware of, if there's any COPD, CHF. I then would provide for privacy, wash my hands, and introduce myself. Hi, my name's Sydney. I'm going to be your nurse today. Can you tell me your name and your birthday?
Erica Smith, 1276.
Okay, and do you know why you're here?
Yes, heart and lung assessment.
Yep. And do you know what year it is?
2017.
And do you know where you're at?
McLaren.
Alright, and the patient is alert and oriented ×4. So today we're just going to do an assessment of your heart and your lungs. So first I'm going to actually start out with a few just basic overall health questions, some basic history, and behavioral questions.
Okay.
So have you ever had any heart or lung issues?
No.
Have you ever had any heart and lung surgeries?
No.
Have you ever had asthma? Any trouble breathing?
Nope.
And I'm going to note as I'm talking to the patient, their face is relaxed and I can tell that they're not in acute respiratory distress as I'm talking to them. Do you have any family history of heart or lung conditions, any cancers? Okay. Do you smoke?
No.
No? Are you surrounded by others who smoke?
No.
Okay. Do you have a job that is a health hazard that could put your lungs or your heart at risk?
No.
No? Okay. And as I'm observing the patient, I am seeing that her lungs are rising evenly with little effort. There are no lifts or heaves. Her skin is ethnically normal for her ethnicity. There's no cyanosis, and as I'm now inspecting, her skin is warm to the touch and dry. There's no lesions, there's no bruising, there's no masses as I'm looking, and she just overall has a very comfortable appearance, and there seems to be no distress of breathing. So first I'm going to start by observing the anterior lung field. So as I'm just overall looking, the front of the body is symmetric, and I'm actually going to test for tactile fermentus. So every time I put my hand down, I'm going to have you say 99.
Okay. 99. 99. 99. 99. 99. 99.
And also, when we're in a clinical setting and the patient has on a gown, I would be doing this underneath of the gown, but for our lab video in this setting, we're doing it above the clothes. But as I did the tactile fermentus, as I went down the body, the vibration diminished, and they are equal bilateral on both sides. So next, I'm going to palpate the lung fields, and I'm checking for crepitus. And this is just, in layman's terms, bubbling under the skin. And as I'm checking the skin, there's no crepitus present. So now I'm going to palpate the lung fields. And just tell me if at any time this is tender or urine pain. Alright, and after palpating the lung field, the sound is resonant. It is dull above the pericardium area and the liver, but overall I can hear, I can feel the vibrations from percussing And it's important to go in between the intercostal spaces because then you're hitting rib, and that would be a different sound that you don't want to hear or don't want to feel. So next, I'm going to oscillate, and now every time that I put my stethoscope down, I'm going to have you breathe in for me. Using the right side would be helpful. Alright, so I'm going to use the diaphragm side of this. And after osculating the lungs, there are adventitious sounds. There's no crackling, wheezing, there's no rails. And as she was breathing, I noticed that it was a comfortable flow and she was not struggling to get air in and out for me to do this exam. So next, I'm actually going to have you turn and flip your legs over to the side of the bed, and I'm going to inspect the posterior lung field. So again, as I'm looking at her back, I'm able to see that it is symmetrical. There is no raising, there's no lifts, there's no heaves. And I'm actually going to put my hands right here and I'm going to have you breathe in for me. And the chest expansion, the lung expansion is equal and symmetric on both sides. And I'm actually going to measure the AP diameter. And as I bring it around to the back, I can see that it's a 1-to-2 ratio, which is normal. And now I'm going to feel around for crepitus again, which is just the bubbling under the skin. And as I'm feeling, I feel no crepitus. So again, I am going to test for tactile tremendum. So every time I put my hand down, I'm going to have you say 99.
99, 99, 99, 99, 99, 99.
Okay, and again, as we start at the top, the vibrations are very loud. They are very easily felt, and as I go down the body, they diminish, and they are equal on both sides. They're equally bilateral as I go down, and which is completely normal as soon as we start to get above bones and move farther down away from where the resonating sound is. So now I'm going to percuss the back lung fields. And yet again, in a clinical setting, it would be a lot easier to do this when the patient does not have clothes on, but for the practice of the clinical and that we're putting this on the World Wide Web, we are going to keep her clothed. All right, and as I percussed, I was able to feel between the intercostal spaces, and I was able to hear the sound very resonant. And now I'm going to oscillate the back lung field as well, again with the diaphragm. And every time I place the diaphragm down, you can breathe in for me. And if at any point you feel faint, just let me know so we can stop and you can catch your breath.
Okay.
spacious breath sounds. And again, there's no crackling, wheezing, there's no struggle in having to provide those breaths for me to be able to hear. And they sound overall pretty normal. All right, so I'm going to have you lay back down for me on your back. And so now as I'm also looking at her again, I can see the angle of the thoracic cavity. I can see that is, as I feel that it is at a 90-degree angle, which is normal. So now I'm going to start her heart assessment. So do you ever have any heart palpitations that just
No.
come out of nowhere, anything to do with anxiety? Have you ever had a heart murmur before?
No.
No gallops? Okay. And so first we're going to look at the ape to man. And this is important to find the spots with the intercostals. So first we're going to begin on the right side between the second intercostal. And this is when I'm also going to use the diaphragm again to auscultate. And not that you don't have to breathe, just shallow breathing for me so I can hear the heart sounds. Alright, so we're starting at the aortic, the pulmonic, Erb's point, the tricuspid, and the mitral. And as listening to those heart sounds, S1 and S2 were present. There was no murmur, there was no gallop that I could hear. They're very fluent, it is a regular rhythm, and overall sounds like a very healthy heart. Another landmark to look for when we're looking in the thoracic cavity is the angle of Louis. So we're going to go down the sternum and just in. And this is when the sternum, it's almost like a little notch where the sternum and the midline sternum match up. It's a little notch, and it's just a helpful point if you're struggling to find where different, I'll get my hand off you, where different heart sounds are when we're doing the ape to man, and the angle of Louis really helps if you're struggling, and by finding that notch, you can work your way down, finding the tricuspid and the mitral. So next, we are going to start with the pulses of the body. So I'm just going to palpate the carotid, and it's important to remember when we're doing the carotid to do one side at a time so we don't knock her out. So as I'm doing the left side and then the right side, they are equal and bilateral, and they're at a +2. So now as I'm moving down in the brachial pulse, okay, and let's see this side. The radial, and then as I go down and do the popliteal, posterior popliteal, finding your knee. Okay. Let me fix this so you can see. Alright, the posterior tibialis. It's kind of where that little notch is in your ankle where the bone meets. And then the dorsalis tibialis. The dorsalis pedis. I got it. I'm there. All right, and all the pulses were equal, bilateral on both sides. They were all at a +2 grading, and if the patient was in a gown, we would be able to hit the femoral artery and be able to pick up that pulse, but since she's in pants, it's relatively hard since it is located here, and just within a gown it would be a lot easier to assess. And as I'm looking at her body and the extremities, she is a nice reddish color as we have turned up the heat in the room. She is, yet again, still the same, matching up to the ethnic color. There's no cyanosis anywhere. And now as I look down at the feet, I'm checking for edema in the legs, which there is none, so there would be a grading of 0 for the edema. And now I am taking off her socks.
Just keep it up.
Yeah, just taking off her socks. All right, and I'm going to do the cap refills on the 3 inner toes. And on both sides, the cap refill is under 3 seconds. So I'm going to do the same thing with her arms. So I'm going to be checking for edema, which there is none. And yet again, I'm going to do cap refills on the top of the finger, on the top and the middle 3 fingers. All right, and those were all under 3 seconds as well. And overlooking her, after this entire exam, she has very healthy lungs. Her heartbeat is very regular. Her body circulatory system is working well. The extremities are all nice and red, and we can see that blood is flowing to them equally. Is there anything else I can get for you today?
No, thank you.
All right, I'm going to leave you with your call light, and if you need anything, just let me know.
Okay, thank you.